All right, ready?
Well, first I want to say I am so excited to do this because this is such an important issue for doctors to know about. That I'm honored to be here, and hopefully I can help out just a little bit.
Yeah, absolutely. So, physicians, they often refer to us as the Netflix for medical education. What we actually do is we go out and create educational videos for them from subject matter experts. So I'm just curious why you decided to agree to this interview, as, we're a little startup in Los Angeles.
Yeah, no, it's, this issue is so important. Medical care for trans people is really one of the number one issues out there. And in fact, it's kind of funny that here it was a year and a half ago, we were talking about we need to do a video to educate doctors. Here we are. Good job. Yes, good job. Yeah, and I was thinking, oh my God, this is what we were talking about a year and a half ago. It's long overdue.
Yeah.
Long overdue. Education for doctors who don't understand the issues, don't understand treatments, is really important. And although in my case, I'm a very different case, okay? I totally agree. I'm white. I work. I have a job. I had male privilege in the old days. You had celebrity privilege. You have all these privileges. My transition was very, very different than almost all cases out there, because over the last 4 years, I had never met anybody who was trans. Never. I had dealt with it for 65 years, but I could never out myself, so I never met anybody. So over the last 4 years, it's been an education for me. I am not an expert, and my transition was very different. But I have been able to witness and see the community out there and see what the needs are for the community. So, I'm very humbled to be here.
Yeah, thank you. So, there's unfortunately no formal training for physicians on the topic of gender dysphoria and the transition process.
There's no formal training for trans people either, but
go. No,
yes.
Absolutely. And so there's often misunderstandings from the physicians because they lack exposure to the community. They don't understand the culture, even the pronouns and the language. Mm-hmm. Can you talk through some of those misunderstandings and help them understand what this community is and who the people are?
Well, first of all, I think doctors have to realize that this is not a sexual issue. Although we are in the L, the G, the B, we are the T, the first three letters are about sexual orientation. Being trans is about identity. And I think that's probably the first thing they have to know. It's not about sex, okay? It has nothing to do with it. It has about who you are in your soul as a person. And that may be different than the way the world sees you. And so that's what we're dealing with here. We're dealing with an identity issue that's really a serious issue. I think doctors have to realize that they have to take these issues very seriously. We have in this community the highest suicide rate out there. It's 9 times higher than the general public. 51% of all trans people before the age of 21 attempt suicide. Thank God, no, all of them don't make it. But I have met young kids. I met one who was like 15 years old. The parents were like ideal. I mean, they were perfect. They did everything. It was female to male with so many issues that unfortunately one night he took his life. And the parents obviously this is how bad it is. 2 weeks after after he had passed, they got from the state of California his new birth certificate with gender marker M on it. Talk about a tough deal. So this is what we're dealing with out there. This issue has come forward over the last few years. There's a lot more people who are identifying at a much younger age. And so I think doctors have to realize that these are real issues, and there'll be more of them in the future. There'll be more in the future. So dealing with it properly is so important.
Yeah. So what kind of questions should physicians expect from their patients, and how should they respond to them?
Well, I think the first thing you have to realize is every story is different. You have to learn, the doctors have to learn to be able to deal with this on an individual basis. There are trans people everywhere in the world, Trans people do not have borders, you know. They're in every country of the world. They're just part of humanity, okay? And thank God it is. It makes us a more colorful world. Let's be honest.
Yeah.
It's better with us in the world, you know? And because diversity is a good thing. We have to celebrate diversity. But I think the doctors really, probably the most important thing is listen. Listen to their story. Don't be in a rush to make decisions. To know that when that person gets to that point where they're going to come in and talk to a doctor, this is real serious stuff, and take it seriously. Listen to their issues. Find out as a doctor what you can do, whether you're a medical doctor, whether, you know, a psychologist, any doctors out there, they have to realize that, yeah, these are serious issues. And by the time they get there, they've been through a lot in their life,
Yeah.
you know?
Yeah. So we're fortunate in working with some of the best physicians out there and some of the most forward-thinking. And I think without a doubt, we've heard feedback that this is a very important topic that the medical community is trying to understand and what it means to experience gender dysphoria. Can you talk a little bit from your perspective as the patient, you know, what are the gaps in medical education right now or from the medical community and how can they better care for their patients?
Wow. You know, it's hard for me because I did come from a different place, okay? And just want to reiterate that from my case, if I wanted to see you know, because back in the 80s when I was really struggling, I saw a psychologist who dealt with these issues, and I was in a position to be able to pay for that. You know, I was working, and so my story was very different. For so many trans people, they just don't have the finances to be able to do things like that. I think that's probably one of the biggest issues, whether it's physical medical issues, mental issues, is insurance doesn't understand this issue. They're getting better. They have to admit they are getting better. They're starting to understand it a little bit better. But so many times you're just out there on your own. For me, I couldn't even find a therapist. Today, everything's changed. And the reason things have changed today and why this subject comes up more today is, I think probably number one thing is the internet. The internet changed the game. All of a sudden, some young kid who sees on TV about identity issues knows that's my, you know, I have these problems, can go online and get tons and tons of information where doctors are, you know, the best procedures to get, trans people transitioning on YouTube. Trans people are all, thousands and thousands of transitions are on YouTube. And they can sit there and they watch these things and they go, oh my God, that's me. What am I going to do? So that's changed a lot. Plus, in the media, this issue has come forward. In my case, back in the 80s, when I was really struggling, I'm thinking I'm going to transition before I'm 40, which would have happened in, you know, in 1990. I was going to do it. I'm not going to be an old chick. I'm going to do it now, you know. I got to 39, I couldn't do it. Just couldn't go forward with it. For me, it wasn't time. Plus, this issue was not where it is today. Finally, you know, by the time I'm 65 in 2015, the issue had changed so drastically. Why? Because other trans people had gone before me. The Laverne Cox of the world, Janet Mock, I mean, you name it. There was a lot of people out there on camera talking, articulate, intelligent, you know, great citizens. And I saw that and I thought, maybe I can add my voice to that conversation. So the amount of publicity that I got, and I get letters all the time from young people saying, I could not have done this if it wasn't for you. Or I was going to commit suicide, decided not to because I saw your courage to be able to do this publicly. And so younger people are coming out because of everything that's going on in the world today. And for doctors, I think that probably the most important thing to learn from young people, make sure for that person that that it's time for them.
Right.
You know, it's time for them.
Yeah. Right.
You know?
Absolutely. So I was reading in my research, and just a few years ago, the Williams Institute at UCLA said that there's about 700,000 trans people, and just this year that number is more than doubled to more than 1.5 million. You know, I have to imagine that number is still extremely low. But as you said,
I
the internet
totally agree.
and the community and the people and us as a society become more accepting and better understand gender dysphoria, that number is going to blow up. So from a physician perspective, where should they go to seek information? Are there resources out there for them? How can they reach out to the trans community?
Oh boy, that's a good one. Medical organizations are starting to look at this much more seriously now, and just basically open up the conversation. There are great doctors out there that do tremendous work. Let's take gender confirmation. There are doctors that have been out there for years and years and years, and find out from them.
And kind of transitioning to the patient education side of things, you had mentioned that again, the internet has allowed for patients to do their own research. Patient empowerment around education is big across all topics in the medical community. From a pragmatic standpoint, can you talk about some of the resources that you've come across in your journey that would help patients have that initial conversation and broach that topic with their family and friends?
You know what I noticed is some hospitals have divisions for young trans people. I think that is a great resource. You can find almost all of those online. It's a great resource to start. But you just got to get into it, and just start doing your research. Be smart about it. We have probably the most discriminated part of the trans community is trans women of color. They have the biggest issues with employment, within the sex work business, the murder rates. We lose a trans woman of color 1 every 2 weeks to murder. Okay? I mean, this is serious stuff. We need to help those people. We need to, not just medical care, but finding them jobs. We have housing discrimination, work discrimination, the list goes on and on and on. And so they don't have insurance. They're stuck, and they deal with this every day. And so, the internet is just obviously the great source. Right. But there are some hospitals that are doing some great work with young trans programs within the hospital. Yeah. A great resource for that and the parents. And we don't want to neglect the parents because they need help too. Yeah.
Can you elaborate a little bit on that?
Well, here I am going through everything I went through. And, I started off my kids knew, but nobody, it was the big secret in the family that nobody would talk about. And finally, when I decided, okay, I think I'm going to do this, I brought each one, I have 10 children, each one into my house, one at a time. I didn't want them to gang up on me. I got to do it one at a time. And so we opened up this conversation with my kids, and it was great. They were all very accepting. And I moved on in my life. Then, a few years back, as a parent, somebody in an interview said, well, what if Kendall said she was trans and wanted to transition into a male? I went, As a parent, I was like in shock. Are you kidding me? My little Kendall, she's the highest paid model in the world. She's gorgeous. And it really kind of set me back. And me being in this position, I was like shocked by my response. And because it is difficult on the parents. And there are some parents out there that are just so great, and others, you can hear all the horror stories where they have problems with their father, they get kicked out of the house, the list goes on and on and on. So the parents need just as much help. And that's why I've seen a lot of programs it's for parents and their trans kids, and to help the parents through this, The thing that, once the kids have gone through so much in their life and they've dealt with their parents, I think the great thing is to see parents, after it's over with, everything's done, their child is fully transitioned, that issue is now gone, and they can move on with their life. And I think parents, sometimes they think that's not going to happen, but it's a wonderful thing when you see that transition go through and the kids are happy, they're not dealing with these issues anymore. Their relationship with their parents can be better now because they don't have this big secret burning inside of them. And they just wake up in the morning and be themselves all day. No secrets, no nothing. It's a wonderful thing for a parent to see. I think at the beginning it's very difficult for them, but it's a wonderful thing eventually when it happens. Yeah.
So that question caught you off guard a few years ago. If you were asked that question again now, how would you respond?
Same way I responded back then. Yeah. Are you kidding me? My little Kendall? I would never stop her. I would do everything, and I'm her parent. I would never stop her from doing it. I would have long conversations with her, this is a tough road. I would probably, it would be really tough on me. Yeah, it would be tough. So I understand from a parent standpoint.
Yeah. And so you've alluded to the fact that transition is very much a journey, and it's not necessarily a linear process. For physicians who have patients that they're treating, can you kind of talk to the patient empathy standpoint and humanize what that process might look like so they can better relate to their patients on this topic?
Okay. No story's the same. They're all different. For female to males, you get on testosterone. They have top surgery. You get on testosterone, very powerful drug. Things change very quickly. The voice deepens. You grow a beard. You better get to the gym and start working out and get yourself in shape. And literally, within 6-9 months, you're totally passable. Cut your hair short. For the male to female, it's more difficult. There's more to do there, okay? From, getting through therapy to getting on hormones, which is not that really powerful a drug, but it will certainly change things. It doesn't have any effect on the voice, like in my case. At first I thought, should I have voice surgery? Because that is an option. But to have surgery, gender confirmation surgery, is a total different thing. I've heard only about 32% of trans women actually go through surgery with gender confirmation. One, it's very expensive. Insurance doesn't cover a lot of it. And for some people, it's all about that. But for a lot, it's not. They can identify as female. They go out in the world as female. And they're more transsexuals. They like male sex. The old parts still work. And they just look for in the world that somebody, and they'll find it, somebody that wants to be with them. And so gender confirmation is not that important to them. And that's fine. I mean, I have no problem with that. Everybody's story is different. In my case, being older, basically I didn't want to, I was not, a chick with genitals. And so for me, it was important. I didn't want to, someday die and die the old way. It was just that simple. But that was important to me. But it's not important for a lot of people. Yeah.
So kind of shifting, I want to spend some time talking about the great work that you're doing to move the needle here, and there's a lot of work ahead. In 1972, you said after the Olympics, you were going to dedicate your next 4 years to making sure that you accomplish what you wanted to accomplish. And obviously, we know the results there. Moving to today, on the 2020 special, you said that you're going to change the world, and this is something that you're going to dedicate your life to. And I'd love to hear, as you dedicate the next 4 years of your life, walk us through that vision and that path.
Because when I first came out 4 years ago now, I had never met anybody else who was trans. I couldn't out myself. And boy, did I have a lot to learn about this community. It's very difficult. We started the foundation work. We've been giving away money to just very deserving people and deserving organizations, the best we possibly can, that are well run. But to be honest with you, in the future, I really want to kind of change the foundation into a scholarship program. Sophia, who's the executive director of the foundation, the two of us sat down and said, maybe we can start looking into changing that next generation coming along, okay? Let's educate those people. Let's give them an opportunity. I want trans doctors. I want trans lawyers. I want trans business people. There's so many smart kids out there, who are trans that deserve a shot. And sometimes it's very difficult for them. And so we started with our first one. It was actually a trans woman in Oregon, good old Bethany, who is getting her PhD. And we helped her out with her education along. And then she turned around and helped us out with some things too, helped with the foundation. She has been absolutely great. And that kind of inspires me, we should do that more. So right now, we're out there raising money for education. Let's change the next generation. You know, let's get them out there. Let's get them in school. Let's get them well educated and a vibrant part of our society.
Great, thank you. Well, final question. Better golfer, Caitlyn Jenner or Danielle Kang?
Oh, Danielle Kang. She's on the LPGA tour and she kicks my butt, okay? Yes, we play like dollar skins, and I've never won $1 off of her, and I've had to pay her $5 here, $10 there. Yeah, Danielle can play. Yeah. Here's the better question.
Oh.
Okay, better golfer, Bruce or Caitlyn?
Oh yeah.
Yeah. Now see, because people ask me that question all the time. You know, hey, is it different now, and this and that? First of all, I can go to the ladies' tees, but I always hit from, when I normally play, I hit from the men's tees, that's fine. But actually, right now, Caitlyn's a better golfer.
Thank you so much.
All right.
Thank you.